Hi, I'm Devin. The setting that I was in was in an outpatient clinic, an ortho outpatient clinic. We saw a lot of rotator cuff repairs. We saw a lot of post-op for knees and hips. We also saw a lot of chronic pain, like through the back and through the neck. We had broken bones, definitely through the ankles. Um, and the femurs, those were big ones. What I found helpful for my preparation with this rotation, it being an outpatient ortho setting, what was really helpful was knowing exercises, how to progress, how to regress, and just having like a collection of exercises to work from, and just being familiar with the hips, the knees, the back, the shoulder, ankle, and wrist exercises. It's very straightforward. So just having a collection of exercises to choose from was super helpful for this rotation. For those of you that are coming into this rotation, I recommend really knowing your ranges of motion. So knowing how to do that range of motion with the goni, and how to do your MMTs. I think that'll be really helpful for you. You do help out with taking assessments with regards to like the range of motion and their muscle strength. So being familiar how to do that throughout the body is helpful. I would also take a moment to learn how to do lumbar with a goni. I know that we do it in class with the Inky and we do it with the tape measure, but this clinic, they didn't have those two items, and so everything was done with a goni. So being familiar with how to measure the lumbar with a goni is going to be helpful because you want to keep the measurements consistent. And so if they're doing everything with a goni, make sure that you know how to do everything with a goni. Challenges for this rotation was in this rotation, it's my third rotation. And so everything had to be done like I would be an entry-level clinician. So entry-level clinicians, my understanding, what I was told is they take on a patient every hour. So you start out with 4 in the morning, 4 in the afternoon, and then within a week, you're taking on patients every half hour. So you start out your hour, and then comes the half hour, you start a new patient. And so documenting and treating one patient per hour, you can get it done in that hour. But then the patients start to stack up every half hour. And so it becomes really important to document, for me, quick little notes. And then in the evening, I would go back and I would elaborate on those notes so that it was like appropriate for insurance. So I do that in the evening and I would do that in the morning before my next shift. What was challenging was, sometimes you'll get patients who really need your attention, right? They'll have questions every second. They will need your attention. So they will keep FaceTime with you. And so you have to really learn how to manage that. Say, hey, hold on a moment. Give me a sec. I got to go get this set up. And asking, I worked with a team and they were really big on like, hey, if you need me to set someone up with an exercise, just let me know. I'll gladly help you. So time management in the sense of like, okay, documenting, FaceTime, managing 2 patients, getting one on an exercise, getting another one set up with a warm up, that becomes really, it becomes challenging. Learning how to do it is challenging. It is doable. I kept seeing people do it, so I'm like, this is possible, but it's hard when you start learning how to take on more responsibility. And then always keeping in mind with the patient safety. It's pretty straightforward with the exercises. They're on the table, they're on the floor, they're doing functional movements, they're doing isolated movements. So you're just aware of what your patients are doing when they're doing it, and you have to be aware of in relation to the other patients that are on the floor and the other clinicians that are on the floor. This setting, it was really fortunate. Everyone works as a team, and so you're very much aware of where space is with regards to yourself, your patients, and other clinicians and their patients. And just making sure that the space that you're utilizing is safe and that the exercises that you're providing with the patients is safe. And obviously, if you give them something to do and it's not working, acknowledge that, and that's okay. That gives you something to work on next session. And you do something else, you either regress it or you realize like, hey, this might be a little too difficult at this time. Let's step it back. Let's go try this exercise before we start this exercise. And it happens all the time, right? So it's not really a big deal if you try an exercise with a person and it's a little too much. Regressing it, changing it up a little bit. That's what you do, and it works. Discharging, there's no discharging in this setting. It's more of assisting with like measurements, again, for like the PTs, because it's more like they're more about the progress notes. So you don't got to worry about discharge planning. Just know how to take your measurements so that you can assist, provide that for your PTs. And then what I liked about this setting is I liked the freedom for my clinical reasoning. Like I would have people that would come in flared up. They would say that they weren't feeling good, or I could tell that, one of their limbs was swollen. And so I could make the call to give them a little bit of manual, because it would be so therapeutic for them. I had the freedom to see a person and they're just moving and just have them do exercises the whole time. And I had the freedom to really like manage my time with regards to people. And one of the PTs even said like, hey, we're not in the ER. So if you try to stay face to face and make everything happen every minute, it's not going to be helpful to you or to the patient. We're not in the ER. You don't have to be on it 100%. It's okay to take your time. Like it's okay to say, hold on a moment, let me go get this set up. Or it's okay if they're sitting there for like a minute or two. It's important that they rest. So, getting that advice and then having the freedom to like do that responsibly was really, really cool. And that just, it helped to ease my anxiety in the setting, made me like the setting even more. And this setting, it moves fast. People are coming and people are going, but everyone's always seems to be in a good mood. And the people that are there, some of them are there, they love the workout, they love the exercise. So it was a really joyous experience for me. And yes, I could definitely see myself working in this type of environment for the years to come. So I hope all of this is helpful to you, and I wish you luck on your rotation.